Can you change? Can we? Our climate is changing, demanding that we act. Health is threatened by droughts, floods, storms, heat, and other weather extremes. Already, 13 million people lose their lives to environmental factors every year. By 2050, climate change may drive an estimated 200 million people from their homes in search of safety. We must protect health in the face of climate change. A commitment to readiness and resilience will save lives. Let's protect the people on the front line of the climate crisis, communities at risk, and the health workers that support them. A healthy future demands our action now.
Let's navigate this discussion on health and climate change. Please welcome our moderator for this next panel, Tara Waters, who is Americares Director of Strategic Partnerships.
Welcome to the Climate Change and Health panel at the Americares Partner Summit. As it relates to health. More and more, climate is affecting every aspect of human life, including and especially health. Just think about it. Extreme weather threatens safe water supplies. Poor air quality can exacerbate lung disease. And extreme heat can worsen chronic illness. The climate crisis is a health crisis. According to the World Health Organization, between 2030 and 2050, climate change is expected to cause an additional 250,000 deaths per year from malnutrition, malaria, diarrhea, and heat stress. It will also likely cause heightened levels of morbidity, displacement, and conflict. While the scale of the climate crisis is global, each one of us will see and feel its impact. For some, it's the sound of a loved one wheezing from asthma made worse by prolonged pollen seasons. For others, it could be the stress of struggling to access chronic illness medication while displaced from a wildfire. For others still, it's stomach pain from drinking contaminated water after a storm. For many communities, the climate crisis is happening now. Those affected most are often the least responsible and have the fewest resources to cope. Americares strives to protect health in low-income, low-resource, and marginalized communities around the world. And we provide these communities with the tools they need to maintain health amidst worsening climate change. Today, we will discuss the devastating consequences of climate change and how to best adapt, prepare, and respond to this crisis. Let's meet our panelists. Joining us today is Phil Dahlin. Phil is Global Director of Sustainability at Johnson & Johnson, where he's responsible for strategy and partnership development at the intersection of human health, and the environment. Johnson & Johnson is a longtime partner of Americares, currently working to build climate resilience for community health clinics across the United States. Welcome, Phil. Also joining us today is Ben Money, Senior Vice President at the National Association of Community Health Centers. Ben has over 3 decades of experience working on community health and public health. Now, he is working with community health centers to address root causes of health disparities that influence the health of the patients and the surrounding community. Welcome, Ben. Next is Kristen Stevens, Director of Climate and Disaster Resilience at Americares. Kristen oversees Americares disaster preparedness programming in the US and around the world. She is responsible for implementing programs that better prepare health clinics and health centers for emergencies like climate change, and for directing initiatives that strengthen health systems. Hello, Kristen. And also on today's panel is Claudia Toussaint, Senior Vice President, Chief Human Resources and Sustainability Officer at Xylem, a global leader in water technology. Claudia is responsible for leading global human resources and the company's environmental, social, and governance approach. Xylem is an Americares partner, collaborating on projects that address water, sanitation, and hygiene needs in low-resource communities around the world. Welcome, Claudia.
Thank you for having me.
A quick note for those tuning in virtually. We will have time for questions at the end, so add your question to the Q&A box on the screen at any time. Let's begin. At the start of the discussion, I described just a few of the health impacts of climate change. This question is going to be for all of our panelists to weigh in. How and where do you see the health impacts of climate change in your work? So Phil, let's start with you.
Thank you, Tara. And I'm really glad to be here today and have an excuse to dress up for once. Luckily, my suit was clean. But to answer the question, I think we see the impacts in two main ways. I think, first of all, there's a growing body of evidence that climate change is impacting health outcomes in the therapeutic areas that we work on as Johnson & Johnson. So that's the first. And then the second is, we're seeing impacts to the supply chains. So, in the video that you showed, all of those weather events, we've experienced in our own supply chains over the past couple of years. Last year we saw, we lost use of facilities due to floods. We've had droughts shut down facilities. So we really need to be mindful about how we design, resilient supply chains going forward due to the climate impacts.
Ben, I'm going to turn to you next. What's your perspective with regard to community health centers?
Well, and thank you so much for the opportunity to share perspective of health centers on this very important topic. It's an honor and a pleasure to participate in this partner summit. Americares has been a generous and reliable friend of community health centers, and we're grateful for your support. So health centers are the largest medical home for primary comprehensive care in the country. We serve over 28 million people across all 50 states and territories. 92% of the folks that we serve live below 200% of federal poverty levels. We have 1 in 6 Medicaid beneficiaries, a greater instance of chronic disease, 1.3 million patients diagnosed with asthma, 2.7 million diagnosed with diabetes, 5 million with hypertension, 2.6 million with diagnosis of depression, and 2.7 with anxiety disorders. Many of the health center patients we serve are agricultural workers. They may be experiencing homelessness. They may be outdoor laborers or working in kitchen and laundry facilities. So these are vulnerable folks. These are folks that get hit first and worst by climate-related instances. And also, over 58% of the health center patients identify as racial or ethnic minorities. And in the United States, discriminatory redlining actually forced Black and brown people into less desirable areas of communities where highways, manufacturing plants emit toxic particulate matter, and urban heat islands reduce air quality and magnify the effects of heat. These communities are more prone to flooding and exposure to chemicals that are leached from toxic waste dumps and from agricultural runoffs. One of the things that we see is that our folks are more vulnerable. They have less financial resources to prepare themselves for climate emergencies and shocks. And they also live in communities where there's higher crime, and they're less likely to go to shelters in advance of extreme weather events for fear of burglary. In other words, our health center patients are really experiencing environmental injustices and climate-related events to a magnified degree. Health centers also don't receive any additional resources when they see more patients for more acute conditions or more drastic events. And so we're seeing it both on the financial side, on the side of workforce, as well as, again, the disproportionate impacts on the folks that we serve.
Thank you, Ben, for your description about the complexity of the impacts on that population. Claudia, if you could join us next, and from your perspective of water access.
Great. Thank you. First of all, thank you for having Xylem as part of the Partner Summit here. We're really privileged to be here and to work with you. Our business is water, and so while as a business we've observed some of the same challenges as Phil has laid out earlier, I would say, we have a saying that goes a little bit like this: if climate change is the shark, water is and are the teeth. And the video that you showed really illustrated how climate change comes around and impacts us largely through water. So the impacts of climate change that are felt and experienced, through water are local, and it can be as a result of prolonged drought or as a result of devastating floods, both of which have huge impacts on human health and well-being. And as Ben noted, in a lot of ways, the water is a great vector through which we can see climate change and see the increased suffering for underserved communities. And I think Ben did a great way of describing that in his work. And when we work with our customers, many of which are, water utilities around the globe, we really help and work with them to make sure that communities are prepared from a resiliency perspective as well as from a mitigation perspective.
Great, thank you very much. And Kristen, if you could please comment as well.
Yeah, thanks so much. Here at Americares, we've been aware of the impacts of climate change on health centers for a number of years now. We see it in the increasing frequency and severity of disasters. As many of you know, Americares works with clinics in the preparedness stage before emergencies. We support them during response, and we support them during longer-term recovery. And we see the impact of climate change through all of these areas. I was just on a call yesterday launching a new program in California integrating preparedness and mental health. And we were talking about focusing on evaluating incidences. So a disaster has happened, you want to learn from it so you have a better response next time. Very valuable program for our partners. And one of the first questions was, how do you know when the disaster is over so that you can evaluate it? Because they said they just keep coming one after another. Right? We used to have the occasional wildfire, and then it was wildfire season. And now wildfire season seems to be all year round. So when do these clinics stop and catch their breath, right? When do they take a moment to really capture what learned and to try and increase their resilience, build their resilience? It's a growing issue. I am thrilled with the reception that we've gotten from the health centers that we work with. And in fact, yesterday was also the first time that I had heard a clinic raise to us their concerns about heat as a threat. So we usually think about the big flashy things in the news like hurricanes and wildfires, but heat is a massive killer, and heat is a huge issue with climate change. And yesterday they came to us and they said, heat is an emergency and we are not ready. What can we do with that? And so needless to say, we are already reaching out to them to engage them with our climate work. But we've been seeing this for years, and it's really coming together in a real moment right now.
Great, thank you, Kristen. Thank you, everyone, for your contribution. So in the face of climate change, and given the scale and the scope that you've referred to, it is critical that we work together as a global community. We're here today at a partnership summit. Claudia and Phil, how are your organizations leveraging partnerships and collaborations to address the impact of climate change? Claudia, let's begin with you.
Great, thank you. That's a great question, and climate change is one of those issues, just like water challenges, that cannot be solved alone. So we know that when we're addressing big, societal and climate issues, partnering is absolutely critical. And from a water challenge perspective, this for us means partnering to address climate mitigation, to think about, adaptation and building really robust access to wash, as, access to water and safe sanitation is critical. And that means clearly we cannot do it alone. So we've done a lot of thinking on what are good partnerships to, achieve and kind of advance the solving of these big challenges. And we found that to have really impactful and positive outcomes, we have to partner beyond what we might think as kind of the normal places you would go. And so I'd like to give a couple of examples that we have used to elevate the dialogue and to contribute to positive outcomes and solutions. So for example, there are lots of people around the globe that are absolutely passionate about soccer. So we have partnered with, the Manchester City and the City Football Club to really raise awareness of water challenges, the connections between climate change, water, and health. And while that might look like an unlikely pairing, we've really found it very effective and been able to reach and raise awareness with over 1 billion people globally, leveraging the interest and power of soccer and the commitment together to drive positive outcomes. We also partner a lot with university and venture capital to really accelerate the next wave of innovation, including digital innovation, because digital has a big role to play in, adaptation and mitigation. And then, of course, Americares is one of our partners. And we have partnered, with you very effectively to deliver, WASH education that is able to reach over 800,000 beneficiaries. And so through that, we have reached across 13 countries, 5 million people. So these are very different kind of partnerships, but big challenges just need, a real ecosystem and a different approach to kind of trying to figure out how do we find solutions.
Those diverse examples. And Phil?
Yeah, to add to the comments there, Claudia touched on both climate mitigation and climate resiliency. And, I think on the mitigation side, there are a lot of actions that we can all take as individual organizations and things like that. But when you start to talk about, improving or building on climate resiliency, then you're really talking about changing systems, changing infrastructure, and those things are very complicated, right? And those require a whole network of partners to work on. So, the work that we're doing with you and the clinics and Harvard, really is that focus on resiliency. And there's no way that we could, as a healthcare supplier, I mean, we have a role, we have our voice, we have resources, but we can't really reach all the way out to the clinics and where the impacts are being felt. So, it's necessary that we bring all these parties together to really achieve the impact.
Great, thank you. And staying on that theme of partnership, and it was mentioned earlier about the importance of looking at the local level. Kristen and Ben, you both have experience partnering with local clinics and health centers, our nation's health safety net. How can we better leverage local expertise, including community health providers, to address climate change and health? Ben, let's begin with you.
Yes, so community health centers by statute are governed by the patients that they serve. So they've got deep roots and connections in communities. And health centers demonstrated the value of their trusted relationships in improving COVID testing and vaccination rates in some of the hardest hit parts of the United States. And so when it comes to climate-fueled emergencies, local communities know the impact of previous events. They know where the flooding tends to occur. They know where the most vulnerable people reside and the barriers they face to survival. They also know how people communicate and where they go to, who they go to for information. It's important that health centers, government public health, emergency managers, and community-based organizations engage community residents to co-create solutions before the events occur. And the messaging that's developed needs to be from the community in their language and disseminated through their media. Responses need to be practiced, and technologies and approaches need to be used regularly for other purposes. So in that way, everyone will know each other, they'll know how to communicate, and they'll know what to do in the event of an emergency. And planners need to disseminate messaging through the platforms that are used by communities. They need to figure out, is it WhatsApp or TikTok or Instagram or Twitter or just old-fashioned AM radio where people get their information? Who are those trusted media voices or social media influencers? Also, it's important to engage with community health workers or promoters to educate and prepare their communities. Again, this must be done before an event. Also, data is really important. And data tends to be siloed in health systems, in public health, and even in health centers. But data needs to be freely accessible through information exchange, and it needs to be available to inform health and social interventions on the planning end, as well as during and after an event. Also, health centers and their clinical teams can provide anticipatory guidance, particularly for patients with high risk factors that actually increase their vulnerability. And it's also important to recognize that there are some things that can be done in resilience for health centers to support ongoing operations as well as to assist their community before and after an event. So one of the things that we saw just last month during the power blackout in Puerto Rico was that the health centers that were equipped with solar microgrids, that's solar panels with battery backup systems and alternative generators, were able to stay operational. And they were able to provide clinical services and resources when everyone else was without power. And so Americares and Direct Relief actually made significant contributions to developing the transition to solar microgrid power development projects on the island. And these power systems also provided electricity to water systems so folks could have clean and available water. We also need to know that communities are going to need to prepare for the economic and resource shocks that climate change will bring. So the World Bank has estimated that global demand for food is going to increase by 50% by 2015. And over 100 to 400 million people could be at risk of hunger around the world. So one of the things that health centers can do is, and are doing, is they are partnering with community-based organizations such as Feeding America and the food banks, and working to establish community gardens, food distribution programs, produce gleaning, urban farming, as well as co-op grocery stores and food deserts. So the combination of climate-related factors to health and the economy are really going to require more resilient community health centers that are partnered with trusted and close relationships with the residents that they serve.
Kristen, I'm sure a lot of what Ben was just talking about resonates deeply with you, given Americare's focus and our work. Talk to us about how we leverage local expertise.
Yeah, absolutely. So I wholeheartedly endorse everything Ben just said. That was a perfect overview. The one piece I would add from a very specific emergency management perspective is, the old line that all disasters are local. So disasters begin and end at the local level. And it's so important. It makes sense when you think about it, right? Something happens and the first people to respond are your neighbors. It's your local fire department. It's your local rescue. So many of the things that end up in the news are the ones where organizations like Americares fly in from various places, but it really starts at that very local level. And when the news headlines have passed and the community and the cleanup is underway, all of that remaining work is taken care of at the local level. People would be surprised to know that the mental health response from Hurricane Katrina continues to this day. And this is being managed in community health centers. This is where people live. This is where the most vulnerable people in communities are getting their care. I think it's also important to remember too that, when we look at investment in preparedness and investment in climate change, the work has typically focused on the acute care health centers, right? Which makes sense because that's where emergencies are handled, right? That's where people are born, that's where people die. But the next sort of investment goes to things like nursing homes. Community health centers are at that outer ring of investment. But we also know that people who are most vulnerable to the impacts of climate crisis are being served at these health centers that are not the primary focus of the investments. And so that's one of the things that we're really focused on, is supporting these local community health centers, these local healthcare providers who are working with the most vulnerable people who are already the most under-resourced and are not getting the biggest investment to begin with. And that's a huge driver of all of our work around climate resilience and climate health equity.
Great, thank you, Kristen. There's been quite a bit of talk already about the link between climate change and health disparities. Phil, I'd love for you to weigh in on this as well, and talk to us a little bit about how the impacts of climate change is more severe for people who are already marginalized by income, race, location, and what Johnson & Johnson is doing to address this.
So Ben touched on a number of the topics there. The communities that are kind of most at risk of the impacts of climate change are also often the same communities that have been marginalized in terms of their access to quality health care. Back in 2020, Johnson & Johnson had announced a new initiative to address health equity. So significant effort. We're going to invest $100 million over 5 years to tackle the issue of health equity. And we started to examine, well, we've been looking at climate and health. Is there something that we could do around health equity specifically? So with that understanding that climate change is going to disproportionately impact vulnerable communities, is there something we could do there? And so the idea of, are there things that we can do to help build resilience of the healthcare system, and especially healthcare delivery. And we became aware of what Americares was doing. And a colleague of mine, Kim Keller, said, hey, I've got this wonderful partner. You should talk to them, Americares. And so that led to a number of discussions. And that's how these things work. You start to have discussions. You hit on, hey, we're also working on that topic. Maybe there's opportunities to collaborate. And so with I'd say the tailwind from Johnson & Johnson focusing on health equity and, with us looking at how do we evolve our work in climate and health and, the interactions with Americares, it just, it was kind of a natural fit. So, we're happy to be working on this, this program to help strengthen the resilience of these community health clinics. So.
Thank you. We're grateful for your partnership. And turning to another one of our partners, Claudia, you mentioned earlier that Americares partners with Xylem to address water, sanitation, and hygiene, also known as WASH needs for vulnerable communities around the world. Talk to us about why WASH is so critical in the face of climate change.
So I think we've talked a lot about how climate change and the adverse impacts from an environmental perspective will only get worse. And whether that is in terms of droughts, whether that is in terms of floods, whether that is in terms of severe weather events like hurricanes. And all of that means that the access to wash and hygiene is critical to human health. And this comes in the form of, access to clean drinking water. We all learned during the pandemic how incredibly important it is to have water to simply wash your hands to control disease and advance, health. And the management of and appropriate management of sanitation is absolutely critical. And we see that every single time when we have, a hurricane or, storm water overflows. So climate change will exacerbate health issues. And WASH and access to WASH will be a critical lever to help create more positive health outcomes. And I just want to share, and sometimes we think that this is only something that happens in, kind of certain communities that may not be that close to where we live, but it happens, widely across the globe. And so what I want to share are just maybe some statistics to just remind all of us, what the status is today, and that is likely only going to get worse unless we do effective partnering for further investment in, resiliency and mitigation. So today, roughly a quarter of the world's population lack access to safely managed drinking water. That has a huge impact on health. Nearly half of the world's population lack safely managed sanitation services, and roughly 30% lack basic hand washing facilities at home. Those are huge numbers. And when you put kind of climate change and the adverse impacts from climate change on top of that, it just requires us to think differently. It requires us to partner differently. And that is why, in partnership with Americares, I think one of the key areas to focus on are community, health centers. Because we know that when we provide support there, we have a huge opportunity to disproportionately impact communities' health needs and outcomes positively. And that's why I think WASH and the partnerships around WASH will be even more important as the impacts from climate change continue to accelerate.
Thank you, and we are proud to partner with you to reach those 5 million people with better water, sanitation, and hygiene. That is hopefully, tapping away at some of those harrowing statistics that you just shared. So thank you for that. So Claudia, you had mentioned emergency response. So jumping off from there, I wanted to talk a little bit about displacement. Obviously, Rashad spoke about displacement earlier this morning. We know that, as climate change forces people to move, that displacement is just going to become a more complex crisis. The World Bank estimates that by 2050, climate change could displace 216 million people. So Ben, I'm going to start with you and then turn to you, Kristen. I'd love your perspective on how can we protect the health of people who are forced to move, and also, as Americares often focuses, how do we also protect the health and support the communities that are hosting displaced individuals?
Yeah, thank you. And I think it's really important to understand some of the underlying factors around particularly displacement within the United States. I'd mentioned low-income residents being relegated to redline communities that are more vulnerable. But it's also been pointed out by the EPA that a lot of those communities are also excluded from adaptation investments that would provide things like nature-based infrastructure that would protect their homes, their properties where they live from flooding. So what ends up happening is a lot of lower income people are actually displaced unnecessarily. The other thing to recognize is that so many of the low income families lack financial resources to prepare and recover from disasters. And COVID really demonstrated that many of these individuals deemed essential workers lack health insurance benefits and even sick time. So any disruption puts them further in the hole. So they're often forced into the difficult choice of abandoning personal matters to report for work. Also, a larger portion of Black and Latinx homeowners' net worth is tied up in their homes. They have fewer liquid assets, fewer savings to pull upon. And as a result, when flooding occurs, they're the least likely to be insured. They suffer the greatest loss, bankruptcy, and ruined credit. So it's important to note that all these factors really impair a family's ability to make the kind of decisions, have the kind of options that a more resourced individual or family has in the face of a disaster. Also, just the hassles and frustrations of dealing with complicated bureaucratic systems, particularly when the documents they may have were lost in the flooding. All that does is magnify the emotional trauma. It creates significant mental health stress, often leading to fractured families and broken community structures. In socially vulnerable people are often less able to successfully migrate away from adverse climate conditions, such as repeated flooding, loss, and trauma. And when people are displaced, they lose community connection, relationships, and eventually culture and language. For example, consider the changes experienced by New Orleans residents displaced by Katrina, or the Marshallese Islanders that were relocated to Arkansas due to rising sea levels, or individuals crossing the southern US border, fleeing from poverty, crime, and violence, exacerbated by climate-induced droughts, landslides, and the like. So when people are displaced, they need to be connected to their healthcare providers. Health centers use electronic medical records, but often these records are not interoperable, meaning they don't exchange with one another due to proprietary interfaces by the developers. There needs to be free data exchange and the elimination of data blocking practices. We also need to utilize telehealth more frequently. It's critical to assure that people have that continuity of care, particularly when they're in remote settings. And as a society, we need to acknowledge the impact of excess consumption from developed countries to the underdeveloped world. We've got to prioritize mitigation activities that reduce carbon emissions while we are in this rapidly closing window of time, estimated at being less than 10 years. We've got to be able to blunt the impact of global temperature rise. This means a rapid worldwide shift to renewable energy and halting deforestation. We also need to consider the agricultural demands on land and water and shift our dietary consumption to plant-based foods. In the United States, to address affordable housing, access to healthcare, we've got to have a conversion to renewable energy.
Action-oriented ideas in there and a great call to action. Thank you for that. Kristen, please weigh in on displacement.
Yeah, thanks. So I'm looking at it from two ends, specifically from that community health center end. So one of the things that I'm thinking about is making sure that health centers who are in areas where people might be migrating into are prepared for that. And understanding how it's going to change their community profile, how it's going to change their patient profile. What is it going to take? Do they have the staffing resources they need, the language and interpretation resources they need? We saw a lot in the following the 2017 hurricanes, for example. Large numbers of people moved out of Puerto Rico, some temporarily, some permanently. And what does that do to the communities that they move into? Are health centers ready for this? Can they meet the increasing demand? So that's one of the things that we think about on the receiving end. But I'm also very concerned on the end of the communities that people are leaving, because we know that the first people to leave communities, the first climate refugees out of communities, are the people who have the means to leave. And in many communities, this can mean healthcare providers. So people who are already getting their care at safety net centers, there may be fewer staff to care for them. There may be fewer resources. It's a loss of the property tax base. People can lose jobs. So people who are living in poverty can sink further into poverty. So all of these inequalities that already existed are going to be exacerbated by the migration out of the first people who have the means to do so. We saw this in following the 2017 hurricanes on the healthcare front in some work that we did at Americares in the U.S. Virgin Islands on preparedness. A year after, in the year 2018, they only had one psychiatrist for all 3 islands. There was no cancer care at all on any of the 3 islands. So if you had cancer or needed screening, you had to be able to afford to get yourself to Miami. And not everybody can do that. So what we're going to be seeing is, with this type of migration out, we need to think about the order in which people are going to move out and the impact that it's going to have on the community left behind, right? And so when those people do eventually leave, if they are eventually able to leave, health issues that they have might be significantly worse than they were before, because they have not had their healthcare needs met, right? They have not had access to screening. They have not had access to preventive care. So it's an emergency that's going to continue to compound itself as we move forward. And that's one of my biggest concerns around migration.
Thank you, Kristen. So we've addressed a range of ways that climate change affects health. I believe we have a few minutes for a couple questions from the audience. If anyone, then we're going to wrap up with a few final words.
Just tie it on that.
Yes, please, jump in.
I think the term climate refugees gets a lot of attention. People have lost their homes, lost their livelihoods, and are moving because of that. But there is a subset of people that are moving because they've lost their access to healthcare, right? So they're either going through chemo or dialysis or something that requires continual care. And they're having to move because of that. So that kind of healthcare refugee term, also needs to be brought up as well, because that is happening.
It's an important point. Thank you. Okay, so any questions from the audience before we wrap up with final thoughts? I'm going to let my colleague.
Hi. My question is for Ben, because you touched on this a little bit. We talked a lot about the physical impact to health as a result of climate change. Can you lean in a bit more about mental health impact, a subject very near and dear to Americares?
Yeah, absolutely.
So everyone can hear. So this is for Ben. Oh, sorry. Go ahead, Ben, about mental health impacts due to climate change.
Yes, absolutely. That's an excellent question, because we know that folks that have experienced a climate-related event, particularly a dramatic event, have post-traumatic stress disorder. Also, children develop adverse childhood experiences, or ACEs. Over 1/2 of the world's children currently live in countries that are in an extreme risk for the impact of climate change. So we see anxiety and depression. Also, the uprooting of communities, particularly those that are leaving areas where they're losing culture, loss of familiar food, social connections, can create a significant amount of depression. We also know that in extreme events, particularly extreme heat events, there's an increase in interpersonal violence. And people just overall feel a threatened sense of belonging. There's a term called eco-anxiety. And actually, there was a survey that was reported in the journal Nature last September, where they asked 10,000 young people in 10 countries around the world about how they felt about climate change and the government's responses to it. And most of those young people felt that they were concerned about climate change, with over 60% saying that they felt very worried or extremely worried. And over 45% of participants said that their feelings about climate change impacted their daily lives. So this is something that, whether you're going through or gone through a climate-related event, or just the anticipation of it, is creating a tremendous amount of stress and anxiety around the world.
Great, thank you so much. Maybe we have time for one more really quick one before final remarks from all of our panelists.
I want to thank you all for all your insights on this. This is great. This question is for Claudia. You talked a lot about WASH and obviously the importance of it. What do you view as the biggest challenges to creating reliable, safe water networks?
So I would say I would say the biggest challenge today has been that water and climate, the connection has not been as clear. Until recently, water was not really core to the global climate change conversation. And water technology has a clear and very important role to play to prepare communities that community health centers are in to be more resilient. And so continuing to draw the connections and elevate the dialogue between the connection from climate change to water to health outcomes, that is incredibly important. And so as we elevate the conversation about water, we will attract investment, and that will help us build, reliable, safe water networks, because investment is needed, partnership is needed, and policy collaboration is needed.
So much. Okay, so we're going to wrap up soon. In our last few moments here, I'd love to hear from all of our panelists in just a few words. What needs to happen in the next 5 years to protect health given the climate crisis? So, Phil, let's begin with you.
Okay, well, I'm going to take off my Johnson & Johnson hat, put on my personal hat. I think, as an environmental scientist, public health professional, I think we need to take a whole health approach moving forward, looking, really comprehensively at physical and mental health, And not only that, but at the social and environmental determinants that impact health outcomes, at the patient and population level.
Thank you, absolutely. And Kristen.
Yeah, I would challenge people. We need to get bigger, faster. This crisis is here now. We need to throw everything that we have at it. I keep telling people, if you did not like COVID, you are not going to like the climate crisis. This was just a preview to what we are going to be experiencing into the future. And the time to take action is now. Partner, throw everything that you have at these issues. Think about it, integrate it into all of your work across all your projects.
Love it. Thank you. And to Claudia.
I would say two things. We need to continue to increase investment in water infrastructure to build the resiliency of communities and to be equipped to be better prepared for the increasing numbers of disasters we're going to see. And to Ben's point earlier, we have to green the energy grid to mitigate the impacts of climate change.
Thank you. And Ben, bring us home.
Connecting all the dots. I think we need to recognize that this climate crisis is an existential threat to humanity. We have the knowledge of the reason why. We have the technology. And I would argue we also have the financial resources to be able to make those drastic reductions in worldwide greenhouse gas emissions and make that transition to green energy. Unless we do that, and unless we do that in that closing window of opportunity that we have, future generations for millennia to come will suffer from our lack of action. So we have the means, but do we have the will? We need the will to act.
Absolutely. Thank you. Thank you so much to all of our panelists. It has just been an honor to guide a discussion on a topic that affects every single one of us in this room. As everyone has emphasized today, the time to address climate change is now. So I want to thank our audience too for participating and being a part of this conversation, and then we hope that you will continue the conversation in your organizations and your communities to help protect the health and safety of our global community. So thank you very much.